Good afternoon, everyone. Thank you for joining us. My name is Marissa Waterman. I'm the Marketing Director here at the Academy. Today's webinar is titled Enlightening Policymakers to Environmental Health. Our Executive Director, Dr. Daniel Oather, will serve as a moderator and will introduce our speaker today. During the presentation, you'll be able to submit a question by clicking on the Q&A icon on the bottom of your screen. We'll do our best to address each question at the end of the presentation. Before we get started, Dr. Oather would like to say a few words. Dan, how are you?
I am fantastic, Marissa. Thanks so much. I appreciate it. So good afternoon or good morning or hello, wherever folks are today. Welcome to an important and timely webinar. As many of you know, the Academy is organized as a 501c6 under the U.S. tax code. Well, what does that mean? Well, it means that we're a not-profit, so we don't pay taxes. Many people are familiar with the 501c3, the organizations that are set up as foundations. But as a 6, it means that we are a trade association. That allows us some greater flexibility to advocate for the profession. And one of the ways that we advocate is to understand how to engage with the public, how to engage with policy leaders, including politicians and their staff. Advocating for the profession is something each of us can do and something the Academy can support. And we have a great example of that in the form of our webinar today entitled Enlightening Policymakers as to Environmental Health. Before we get started with the webinar today, let me begin in the same way we begin all Academy programming, namely by offering a thanks as we recognize our patrons. Patrons are utilities and firms who financially support the programs of the Academy. When you get a chance, please say thanks to these folks for stepping up to financially support Academy programming like today's webinar. And if you'd like to learn more about how your organization can sponsor a webinar or how you can get involved as a patron, please let me or Marissa know. We're happy to answer your questions and explain the value proposition. Today, it's my privilege to introduce Doug Farquhar. Doug is an attorney with 30 years of experience working with policymakers on environmental health issues. As noted in his bio, Doug has testified 60 times before legislative committees in 36 different states. Well, what does that mean? Well, it means that Doug knows that environmental health and environmental engineering and environmental science are fundamentally local solutions to problems. And that means that local folks, including state legislators, need to hear about and understand all that we can do as a profession. Everything that we do that improves the lives of the public, especially constituents who vote. In April 2020, Doug began as the Director of Government Affairs for the National Environmental Health Association, or NEHA, which is headquartered in Denver, Colorado. Prior to coming to NEHA, Doug directed the Environmental Health Program for the National Conference of State Legislatures. He's worked in the Texas House of Representatives for the Natural Resources and Appropriations Committee and for Congressman Schaefer on Capitol Hill in Washington. Doug received his law degree from the University of Denver and his undergrad from the University of Texas in Austin. He's an adjunct professor in the University of Denver's Graduate School of Environmental Policy and Management, and he's an affiliate professor at the University of Washington School of Public Health. All this to say, we are very fortunate to have someone of Doug's background and expertise speaking with us today on the important topic of enlightening policymakers as to environmental health. Now, Doug is delivering his presentation to us today from Washington, D.C. He's actually there visiting. He's actually outside the Senate office building. So if we hear noise in the background, it's because Doug is actually in the nation's capital doing his work. And we really appreciate that he's taken some time out for us. I want to remind you that I have the privilege of moderating a question and answer at the end of this presentation, so it'd be great if you would share your questions in the Q&A panel, and I'll use that to help moderate today's discussion. Now, with all of those instructions, Doug, my friend, the stage is yours. We are so excited to hear from you.
Thank you very much. Appreciate that introduction. As Dan mentioned, I am speaking to you from the courtyard of the Russell Senate office building. Beautiful day here in DC, but it is also an incredibly busy day here in DC. The Senate and House are back in session, and they are really getting ready for a very busy few weeks coming forward here. But as I say that, and as I talk about all the work we do in Washington, I have to highlight that the main issue, which is environmental health, is primarily state and local. That's where the action is. It is primarily funded by local taxes, state and local taxes, state fees on local industries and businesses. It is something that every jurisdiction invests in, because there's no way for you to have a solid community without a robust environmental health system. One of the things we have discovered in our research is that even the most remote, small, rural public health system has an environmental health program. They may not have things on chronic diseases. They may not have things on HIV, AIDS. You go down the list, but they will always have a program dealing with food safety and dealing with water, and we're dealing with wastewater. You will always have an environmental health program. That means we discover a lot of these things we're discovering at the state and local level. What I mean by that is PFAS in the water and in the environment. We're getting that data from the state and local. We get data on climate change and how wildfires impact communities from the state and locals. We are learning about West Nile viruses, other vectors out there from the state and locals. And we also learn about what's emerging out there. You start talking about recreational waters. You start talking about the different pools and the different spray pads, splash pads, the different ways that people are using recreational waters. That is all coming and getting learned about at the state and local level. Body art, the new way of piercings, different tattoos, different subdermal implants, new ways to do body art. That is coming from the state and locals. Mobile food operations. We've got different things that is emerging in the state and local. Illinois has a bill right now to allow mobile food trucks to be unregulated, because as part of their food freedom movement. Private wells, we have states out there that are doing very active issues dealing with private wells that are not covered by the Safe Drinking Water Act. These things are exempt. It's up to the states and the locals to address it. Cannabis. And if any of you are on the call, remember 2010? You remember in 2010, cannabis was illegal across this country. Now it's legal in almost every state with the exception of Idaho and Nebraska. And it's something that we did not know we were going to have to address. So, one of my things, and I say this over and over, every state, local, territorial, and tribal public health program, every community needs to have a robust environmental health program, because without it, your community cannot exist. So, whoops, going too fast. Now, with us saying that, how much do people know about environmental health? How much does the public understand environmental health? How much do decision makers understand about environmental health? Even the public health boards. A lot of times they don't have an environmental health person sitting in that board. Doctors, people dealing with clinicians, different things. But you don't have someone out there who's like, yeah, we also go out and we inspect the food, we inspect water, we address private water. It's very unfamiliar. And that gets very reflected in the national budgets. When you start talking about different things like I said, HIV, AIDS, epidemiologists, chronic diseases, they got huge federal programs funding these things and these activity at the state and local level. When it comes to environmental health, we don't have huge programs. We have small programs. We have the National Center for Environmental Health. We have FDA's Human Food Program. We have ATSDR. We have EPA, but even EPA only does very, very little on environmental health. And I think I'm being saying very little, if I'm talking about out of their entire budget, it's not a huge element of what they do. And it gets to be even more telling with the fact that the recent administration did a reduction in force for the National Center for Environmental Health. Basically, half their program, the half that is not part of the lab, the half that deals with prevention, outreach, working on lead, working on asthma, working on ALS, working on food safety, that has been eliminated, or at least had a reduction in their workforce. And it is very, very limited right now about what's happening. And we will talk more about what this new administration, what the current administration would like to do with environmental health. But for now, we can say that Congress, it has very little presence. We do have a Congressman Rob Whitman from Virginia. He's a Republican, but he also used to be on the Virginia Department of Agriculture's seafood inspection. He is actually an REHS, Registered Environmental Health Sanitarian, credited by NEHA. So he is he understands food safety, and his office said, would you help us have him go out and talk about food safety and understand what's going on, what's currently going on out there. So we actually have an advocate in Congress who understands it. The sad thing is he's not in charge of the environmental health program. He's not in charge of funding the appropriations for CDC. I'm very curious about what he thinks and what his office thinks about the changes that are going on. With so little federal support, it really falls on the state and locals. When you start talking about the state and locals doing this means the industry, the businesses, they're the ones that are impacted. They're the ones that come forward honestly and say, we need these programs. When we have situations out there where environmental health programs have been eliminated, it's been the industry, the tattoo parlors, the restaurant industry, the recreational water industries that come forward to the boards of health and saying, this is a program that we absolutely need to have. Please don't cut it off. If you need to put a fee on us, put a fee on us. How do they have this authority? Well, this is something that probably just nerds like me who have a legal background care about. But essentially, one of the things I try to highlight with everyone is the word public health nor environment. They don't exist in the Constitution. There is no direct authority for the federal government to address environmental health or public health for that matter. It is retained in some broad language, but most efforts that are going out dealing with environmental health come out of the Commerce Clause, saying the fact that the federal government has the authority to regulate commerce in between states or tax policy, which is where we got the Affordable Care Act, Obamacare. They have authority over that, but they don't have police powers to come in and saying, we can go in and we can inspect restaurants. We can deal with food safety. We can deal with water. We can deal with wastewater. That is really all delegated, not delegated. It's all the responsibility of the state and local, tribal, and territorial governments. These governments have vast authority to protect and promote public health and the environmental health, but it is something that is not done with direct funding, direct authority. It's not delegated. Now, there are a great many parts of the federal programs that are delegated. Clean Air Act, Clean Water Act, Safe Drinking Water. Yeah, those are delegated to the states, and the states have been very proactive about adopting it. But the reason that Congress developed these programs in that manner was because it is the state and local governments that are on the ground that can implement this. You can't run a national program from a cubicle in DC. It just can't be done. It is required. It's necessary for the state and locals to be involved, to be active, to be engaged, to be able to get environmental health implemented. They aren't engaged. It does not happen. So it's extremely important that we remember that the state and locals have this authority and that they utilize it. If something comes down, People often blame the EPA, people often go to the federal government, but the action and the responsibility is going to be at the state and local level. Services, and this comes from research that was done by NACHO, National Association of City and County Health Officials, back in 2002. But if you start talking about local health departments, what do? 75% of them inspect food service establishments. 70% look at schools and daycare. 62% do septic system, recreational waters, body art. These are all part of a local public health program, and it shows that such a huge part of local public health is environmental health. Now, there are certain things that, yeah, not everybody does, but you can see vast majority does food safety. They look at public health nuisance abatement. They do vector control, indoor air quality, land use planning, radiation. These are all things that are done at state, actually at the local public health department. They are where the action is. So we can't underestimate, we can't negate environmental health. It is not something that can be eliminated, and that you can actually have a surviving, thriving community. And I often would tell legislators, yeah, if you want to get rid of environmental health, see how long that lasts. If your toilets don't work, if you don't have water, if you cut off these major issues, you can't do it. You can live for quite a while without money going to USAID. You can live quite a while without USDA getting huge subsidies. You can't live a day without safe water. These are things that are core to our any survival of any community. So it's very important. Now, legislatures. These are my people. That's the U.S. Congress. That's the state legislators. That's the county commissioners, city and tribal councils. They are elected by the people they govern. That means if they do anything to upset those people, they get voted out. They get chased out. They do not get to implement the programs they want if it's something that's adverse. These people are inherently cautious. They don't want to limit freedoms. Even the most liberal legislator will hold back, will be conservative, honestly, about any sort of intrusion on a person's liberty. Now, we do see several policymakers on the other side who are very, very adamant about not intruding on personal liberties at all. They don't want restaurants inspected. They think that people should be able to sell foods that they want to the public, any food that they want to the public. They have a belief that it is really up to the local communities or up to individuals to test their water to make sure it's safe. There are people out there like that, and many of them are elected officials. But there are many out there that do see that there is a benefit to environmental health programs, to environmental health regulations, and they want to make sure that these programs are implemented and are in effect. However, as I said before, any elected official is going to be inherently cautious. That's going to be the nature. If they're inherently reckless, they do not get reelected. It is something that there's always a battle out there about who gets elected. And it's not something that if you're adverse or promote policies that are adverse to the community, that you're going to get reelected. So it's something that we got to remember whenever we talk to policymakers. And plus, one policymaker is only one vote. Every governor is one vote. They also have to get this through the legislature. Every city council, the councilman has one vote. They have to deal with the other councilman. Every board of health, each individual is one vote. They've got to convince everybody else. This is something that's going to take a lot of effort, insight, a lot of work to make sure people are understanding of what we do in environmental health. Okay, the legislative process. This is something that to me is simplistic and is something that everybody should know from high school civics. But I get shocked to learn on how many people never took high school civics. It is designed, our founding fathers, every state legislature, the process they have is designed to be very, very slow. It is designed to be very, very, it's not designed for policies to get enacted. They're designed that that a bill, an idea comes forward, and then you have to convince a legislator to turn that bill into or draft a bill from that and introduce the bill. Once you get it introduced, then you have to go through the thing about, is it going to get which committee does it get assigned to? If the speaker doesn't like the bill, easily send it over to the kill committee, where every state legislature has. If you don't go to the kill committee, if you actually go to a committee that actually has some knowledge about it, then you have a chance to make your case. You make your case, they have the opportunity to either agree with you or disagree with you. If they agree with you, only then does it go back out, and it goes back out to the floor. Then everybody, you got to have a majority of the legislators, of the elected members vote for it, say it's good. And only at that point does it go over to the other chamber. Then you have to go through the whole process again. You have to go to the committee. You have to provide the hearing. You got to hope and encourage them to pass it out of the committee. Then it's got to go to the floor again and see if they're going to adopt it. And if at any point along that process they amend the bill, it's got to go back to the first chamber, and they got to agree to those amended changes. After all that craziness, if everybody agrees to the language and all the policy and everything, only then does it pass out of the legislature and go to the governor, who in every state can veto it. Now, there are two ways of vetoing. One, you can actively veto it. The governor can sign their name and say it's been vetoed. Or they can, in many states, they can just simply ignore it. If they don't do anything, then it's called the pocket veto, and it doesn't become law. So there's many different ways to kill a bill, many more ways to kill a bill than actually get it passed. So the only things that get passed are the things that have been studied, heard testimony from every single angle, have been amended, have been adopted, have been modified to say this is a policy that we think is good, that we should apply to the entire state or the entire jurisdiction, and we need to move forward on it. It is very, very difficult to get a policy adopted. So what are some of the state and local environmental health policies that you have to deal with? Well, you got housing. You've got cannabis. You have tobacco, body art, lead poisoning, fish pedicures, pink slime, recreational water, lead pipe. These are all things that the state and locals are having to deal with. One picture I have not included in here because it was a little bit too much, in my opinion, was one I had to do when we were dealing with body art in Iowa. The director of environmental health for the state, he did not have the authority to deal with scarification, subdermal implants, several types of piercing that were being commonly used in the state. All he could regulate was piercing and tattoo. He needed language amended to say you can deal with all body art. Now, if you understand how body art operates, you will realize that there are many dangerous things that occur. Subdermal implants mean you have placed a product, a material under the top layer of the skin. If that product is made of nickel, it's made of lead, that's going to leach into the body, and then you have a problem right there. You have things with scarification where you cut the first top layer of the skin and you make a scar that's going to be a design. That's not regulated. There's no oversight there. Several types of piercing. If you pierce the collarbone, you can bleed out. If you pierce not pierce, but you tattoo the eyeball, you can kill the eyeball. There are parts of your body you can pierce that is not a problem, but there are many parts that are, and it's really up to the state and locals to be dealing with it. So many of these issues, it fell on the state and local environmental health director's desk, and they either did or did not have the authority to address it. It becomes very difficult to run an environmental health department these days. Talking to decision makers, what really gets them? Well, I like to talk about the 3 H's. What's the topic? What's in there? Tell them what the issue is. How does the story matter? How is it going to impact their constituents? How many people in their district is it going to affect? Public health deals with the broad authority. Environmental health are those environmental things in the environment that impact us. Toxins, chemicals, lead, asbestos, radon. These are all things that we need to really understand and talk about. Make sure that our local policymakers understand that this is an issue in their community. If it is an issue in their community, then we have a reason to respond to it. If it's not an issue, they don't have an interest in it. Like I said, they're conservative in nature. They're not going to want to do things that impacts the public that doesn't have a positive, absolute benefit. So if you have a good story, if you can talk to them about that story, if you can let them know what the problem is and that it's actually impacting their community. PFAS is a major problem, but it wasn't a big issue, so it started actually impacting the public through the public water systems. That's the thing that's going to make them pay attention. That's going to get them to respond. Head, give them a paper. Provide your message. Make it simple. Make it no more than a page. Do not give them your dissertation. They don't want to read it, and they won't read it. They want to see something that they can see quickly, read quickly, and that they convey their issue quickly. Be upfront about money. Don't saying it's not going to impact it's not going to impact their constituency, because it will. Somebody's going to have to do it. And sometimes it's either going to take tax money, it's going to take public health dollars, it's going to require a fee on the local businesses, or it's going to require them to change their business practices, which will make another impact. It does have an economic impact. Be upfront about it. Be honest about it. Don't surprise them. Hard. Make it personal. Talk about individual story. These are all people in your community. One thing I often ask people is, do you know who your U.S. Senator is? Do you know your state senator? Who of those two people can you sit down and have a cup of coffee with? Talk to your state senators, talk to your local public health officials, talk to your local boards of health. They're going to know what's going on. They're going to be most likely to have an impact on their community. It's great to come here to DC and talk to Congress about it, and they do important things here. The direct impact, the ones that you're going to have the most bang for your buck, the best return on your investment, is work with your local policymakers. Health. Provide proof that you're going to have a benefit. Decision makers have to justify their actions to the community they represent. Describing the community benefit, that helps them. They're going to be able to say, we improved the health outcome. One of the biggest things I'm learning out there, I hear out there, food freedom. if you pull away regulations and have no food safety oversight, we've seen no foodborne outbreaks. I can't tell you on how many legislators have told me that. The actual reality is there have been an enormous number of foodborne outbreaks. But we don't have the data to back it up. We haven't done the research. We haven't looked specifically at food freedom movements. We don't know what's really going on. We need to show the policymakers what impact that their decisions have on the public, on their community. Is this going to improve their community? Is it going to make it worse? When you have situations out there where we have several states that have said to the FDA, to the CDC, food freedom laws, these laws that exempt these communities, we haven't seen any increases. However, anecdotally, they'll say, well, that's where our majority of our problem is, but we haven't seen the increases because we're not allowed to respond to that. What I mean by that is in several states, if somebody calls up with a complaint saying there are mouse droppings in this facility that's serving food, there are unsafe practices going on, people who are sick that are serving the food. If it's a food freedom operation, they don't have the authority to regulate it. They can't do anything except for just say, thank you for the information and do nothing. Therefore, we have a situation out there, we don't have the data to back it up. We need to really show what we do has an impact, that this is something that's important. If we regulate a chemical and take it out of the environment, we have to show that there's a benefit to it. If we regulate any sort of activity, let's show that there's a benefit for doing it. Include your voice. What I tell people is engage in policy. Engage with policymakers. They want to know. They want to hear what's going on. One of my number one complaint I heard from state legislators throughout my years was I called the Department of Health. I called my local health department. They never called me back. The only people I ever hear on these issues are the people who are against it to say we don't need this regulation. I never hear back from my public health department. And there's many reasons why, but they don't hear. They want to know. They want to do good. So they need to hear from the environmental health community. Many people say, we can't do that. That's against the rules. But you can always engage in NEHA with the state affiliates, with local associations, where you can have people go in and comment on this. There are people out there who can provide this information. Let them, help them, work with them to provide this information. Government's role, they're all over the board. They're not simply here to make your life miserable. They're here to provide support. They're here to provide direction. They're here to respond to issues that constituencies come to them. They act as a leader. They act as an enforcer, and they execute legislative relationships. They can say, Department of Health, you have to talk with the Department of Transportation. You have to talk with the Department of Agriculture to address this issue, because we're not seeing much activity in that area. Okay, this is what I tell people when they deal with policymakers. Introduce yourself. Let them know who you are, why you're there. Let them know what you do. Our Department of Health does this. My university does that. My research did this. All these things help frame where you're coming from. Why does it matter? What does your work do? Your work with the Department of Health, how you're regulating, how are you inspecting, how many people have you saved? How you do it? We do inspections. We do research. We collect data. Find out exactly what you're doing and be very specific about it, because policymakers do not know. And then finally, tell them how to solve it. They know there's problems out there. They hear problems every day. What they don't hear are solutions. Give them solutions. Give them answers. Help them learn how to address these problems so they can move forward and improve their community. And do we advocate? Yes. NEHA advocates, I'm advocating. I'm here right now with the Alliance for FDA, working with people to save the FDA, CDC. I work with different associations. We're all in this together. We all have the same goal and mission to protect the public. If you want to have a good overview of what I've talked about, how do you talk to policymakers? Take a look at this QR code. Go ahead and download it. This will give you, direct you to the comic book that NEHA put together regarding talking to policymakers. Do you want to talk to Congress directly? I unfortunately believe I lost my QR code, so my apologies. There's another QR code that I will share with Marissa, but it's going to allow you to go there and go to the NEHA webpage and contact your senators and contact your congressmen directly, saying, I want to see FDA's budget increased. I want to see CDC's budget. I want to talk about the elimination of the National Center for Environmental Health. We want to be able to move forward with these programs. This is something that you have so much more power than we do. National associations, we can give the data, we can talk about things nationally, but every congressman wants to hear from their constituents. If your congressman is Robert Alderholt from Alabama, talk to him. Send him a message saying environmental health is important to the state of Alabama. He is the chair of the subcommittee on appropriations for CDC. If you got, if you want to, if you're from Louisiana and you want to talk about importance of food safety, environmental health in the state of Louisiana, contact Bill Cassidy. He is the chair of the Senate Health, Education, Labor, and Pensions Committee. He wants to hear from everybody. He's actually a very, he's very, very insightful. He's very open to hear from people. Talk to him. These are things we need to know. My final thing, what I will say before we go to questions and answers, is the point that we need to get the voice out there. Environmental health is something that is not discussed. We have a bad habit of not communicating with policymakers, then wondering why they cut our programs. Programs are going to get cut where people don't talk. You either have to be at the table or on the menu. Too often we're on the menu. We got to get at the table. We need to get engaged. With that, I'm going to turn it back over to you, Daniel.
Doug, thank you so much. Fantastic. We've got some great questions that have come in the chat. I'm going to ask you, I like that you've got this with the QR code so folks can grab that up. We'll leave that up for 1 second. But what we normally do, Doug, is we like folks to kind of bring the slides down. And then what we do is we'll see the faces back and forth so we can have a little chat back and forth. So if you don't mind,
I will stop share.
Perfect. Fantastic. All right, great. Now we've got some questions that have come in. We've got some thoughts that are coming in. I've put together some questions. Let me talk you through kind of like the stuff that we'll go through, and then we'll kind of come back and hit them kind of one-on-one. So of course, you highlighted that a lot of this stuff is local. A lot of this stuff is personal. You highlighted the head, you highlighted the heart, you highlighted the health. That's great. So we've got a couple of very, very specific questions that came in from folks. So I'll kind of start with some of those because I'll like literally read their question and let you kind of hear it and kind of see how you would answer it. They're reasonable ones, so I think they're totally fair for you to like hear it and then respond. Then we're going to talk through stuff kind of in a little bit of a, not a hierarchy, but just kind of a little bit of an order, right? So you seem like you were talking about the importance of kind of knowing the laws. It sounds like this system is set up to like never have legislation, yet there is so much legislation. So how in the world did we get there? And how do we regulate like materials, like a PFAS regulation versus a technology, right? Like a surface water treatment rule or or a timing of inspections. And then how do we make changes? Like we've got these things like fecal coliforms for bathing, but we know those are just the indicators. So if we switch to other regulations, we get people saying, hey, don't take away what we've, so we'll talk a little bit about the law space, and people had some questions there. we've got to talk a little bit about the people space, right? So you talked about having this kind of local view, but of course, locally, we'll get individuals that have their own personal view. You talked about the food freedom movement, but fluoride's also very popular, right? I want to brush my teeth with fluoride. I don't want to. The city should have fluoride. No. So talk a little bit about that balance between, where does the local person have their individual right? Where does the expert have some right or some space to play? Where does the legislator have some space to play? So, who's got responsibilities for your own life versus somebody else's? So we'll be talking about a little bit of that. And then a little bit of knowing the system, right? So, you mentioned things like pocket veto, but that's got some very specific things to it in terms of when session is ending and all of that kind of stuff. So how do people, get to meet their legislators? You gave some formula, but then we'll get a little bit more into the system. And in that space, we're going to specifically delve into some of these questions like, what's the difference between environmental health and public health? And is there, is it okay to kind of be transitory in our language, or do we need to be highly precise? So we'll come back to some of these kinds of things, but let me start with kind of a broad question out of the beginning, right? So Doug, I've retired after 45 years with a state Department of Public Health, and I understand all the programs you mentioned because I was the director of environmental health services, and I've seen a direct effect of cutting programs. Only for children to get poisoned and almost die, to see sick people put raw sewage in wells, right? So what's public health to do? Public health is not something you learn overnight, right? And so some folks don't want, so what do we do? Is it more how do we become less invisible? Do you have some ideas or things that are going on in that space?
Well, we're trying to, EHA is trying to address that. One of the things is we got a marketing program to get the word out there. We're starting to get more quotes out there in the publications and the trades. It's I think our biggest problem is we are so dang eager to be invisible. We don't want anybody to notice that and every day that nobody gets sick. I mean, think about it. There are 330 million people in this country. They eat 3 meals a day. That means there's 1 billion meals that are eaten every day. And unless there's an outbreak, that shows we're doing a pretty darn good job out there. However, we also know where the problems are, where the issues are, and how do we address those issues. And it is not something we tend not to get called for the good news. We tend not to get called, oh, what are you doing today? Public Health Heroes Day. We're gonna, you're part of the first responders. Well, let's be blunt here. We are first responders. When people get sick, we're the ones there. We're the ones protecting them. Firemen make sure buildings don't burn down. We do the same, that we make sure the public doesn't get sick. This is something that we do, but we've never really couched ourselves in that way. And I don't think there's a simple way of doing it. Outside, you hit it again and again all the time. And you've got to understand, and please take this to note, policymakers want to hear from you. You've got a story. They want to hear it. They want to know what's going on. They want to make good decisions. When they don't hear about stuff, that's when bad decisions are made. When they hear that there's no problem with food freedom, that's when they adopt more food freedom laws. When they hear drinking water is not a problem, that's when they lessen the investment into drinking water. When they hear that fluoride is a problem, that's when they come forward and start saying, well, we don't need fluoride in the drinking water. Between you and me, I think that's one of the most ludicrous things that have come down the pipe recently, but that's something that's gaining popularity.
Lots. And, and those are things that people have their local views. So, another kind of, and again, in this space of kind of like a question that I'll somewhat de-identify in the space, right? But, so Doug, I've got advanced degrees, a master's in public health. I work in a state where a lot of our politicians, are adamantly opposed to kind of like common sense public health measures like masking during COVID or measles vaccinations, right? So So and they tend to equate those things with a political point of view, right? So how do we help separate out some of the science from some of the politics? How do we in public environmental health maybe advocate for positions or advocate for points of view that have perhaps become politicized? So, I put myself in each of those questions saying I, but obviously I'm reading them from the questions here. So how do I do it as an educated person who realizes some of the science behind in these things that are very politicized? How do I work in that space?
Well, the politicized part is unfortunate. But to me, I'm reading this as a double-edged sword. And this is something I have recently got a lot of grief for. But we've never had an administration before take any interest, positive or negative, on environmental health. But Robert Kennedy does. There's something there that I don't think we really acknowledge. And what I mean by that is a lot of his policies are out there, but it really comes down to the environment harms us, which means the logical answer is clean up the environment, make it better, make it safer. And the trick is we know how to do this. This isn't something like, cancers, we don't know where they come from. We know what it is. We know what threats in the environment and what they cause. We can solve this. I would really recommend folks with your intelligence, with your background, with your knowledge, to go in and start talking about solutions. We can solve this radon problem with radon resistant new construction. We can solve these problems of toxins getting into children's foods by investing in research in this area to make sure that, or investing into oversight and inspections, so it doesn't get in the product in the first place. And also, this is something that I don't think any community, the public health community, doesn't appreciate. But take a look at Peanut Corporation of America. Take a look at Jensen Farms. 10%, we lost 10% of the peanut market. That didn't affect Peanut Corporation of America. They got bankrupt, they got sued, they went to jail. There's everybody else that got hit. Every time you have an outbreak from raw milk, people quit drinking milk. So the dairy industry hurts. When cantaloupe, when Jensen's Farms, they tried to make their cantaloupe more organic, and it led to listeria that killed 33 people. The entire fresh fruit industry suffered. Western growers of America had to invest $250,000 to get people to eat cantaloupe again. They won't do it if they get sick. We are here, and when we protect the public, we're protecting industry as well.
Good point.
And we're protecting businesses, and we're making for a safe, robust community. People will invest their dollars into places that they know are safe and efficient. We can help people, we can help communities become that by dealing with the solutions, by dealing with the answers, and protecting the public from environmental threats.
Fair enough. Fair enough. So now in this space, then, so we're going to talk a little bit about knowing laws, a little bit about knowing the people, a little bit about knowing the system, right? So in this kind of this space of knowing the laws, right? So, you talked about 10th Amendment, you talked about Commerce Clause, you talked about things that aren't delegated to the federal, belong still with the states, and you talked about this kind of, back and forth. So it kind of felt like then, as you went through the process of what it takes, kind of, I'm just a bill, I remember that old video, right, of like, how do I get voted on? And it seemed like that it's almost impossible for anything to end up as a law, but yet we feel like we're also just inundated with all these laws we've got to follow. So how does it end up that we've got so much of this stuff if it feels like that it's so hard to get stuff there? Is there any insight as an attorney you can offer to us?
Well, as an attorney, I will go down that direction,
Okay, fair
which
enough.
is, first of all, you have to have the authority. And every public health officer on this call understands if they don't have the authority, if it's not been given to them by the legislature, by their public health commission, by their board of health, by their someplace, they don't have the capability of addressing it. Like I was talking about, the state of Iowa could not address scarification. Does not matter that it had a huge impact on the environment, on the public. They didn't have the authority. They weren't given the authority. This is the first step, number one. And with the legislature, all their authority derives from the public. It's just the Constitution and the way it operates. And I get comments even from my own CEO says, well, Donald Trump doesn't have the authority. He does it anyway. He only has executive authority. The second he leaves, that authority can be taken away. He did not, these aren't acts of Congress. And you got to remember that. And it goes down to the states. The governor can do so much, but it's really up to the state legislature to provide that authority, to execute that authority. Once you execute it with the governor, then he's got to find somebody to do the work. He creates a Department of Public Health. And this is where it got real tricky under COVID. If you read every state law that authorized the Department of Public Health, you realize it's pretty broad. And they did have the authority to do a lot of the stuff they did, but public kicked back. And that authority has been severely limited. And I think you probably recognize that very much. Missouri, there are other states that that authority was severely limited. But it was an absolute reaction. I think COVID really proved to all of us how much the public likes their freedoms, how much they like not to be told what to do. And, even if it's in their best interest, it's something that is inherently offensive. It's just something the American public doesn't like. You start dealing with other cultures, sometimes it's super simple. But for us, it's not. So
I know
we
it. I
really
know it.
do need
As
to
a father,
have our-
as the father of teenagers, I know it. Americans don't want,
Yeah.
don't want to be told what
And
to
it's,
do. Fair enough.
like you said, wearing a mask, think about what kind of pushback we got on that.
Sure.
So when we get a situation out there, like with raw egg, with raw milk, Vermont, you can have raw milk ice cream. I call it the Ben and Jerry law. The nature of what you can do in Maine, which is you can go down to the local fisherman dock and buy all the shellfish you want and sell it without any sort of inspection. And as much as my folks in Wyoming laughed at me, I said, well, wouldn't your law permit some bar owner to start a vat in the back growing shellfish and having oyster nights? And they're kind of like, oh, that'll never happen. Well, let's see. Let's see what that comes down
Let's
to.
see if it does. So now
Yeah.
in knowing these laws, right? So there's some different stuff to kind of piece out here, right? So we think about public health, we think about occupational health, we think about environmental health, we think about that we regulate sometimes materials, we regulate sometimes processes. Is it when we're meeting with the legislatures, like there's one thing when we're in professional practice, we got to know the letter of the law and what our authority is. When we're meeting with the legislators, do we need to be as precise in our language to understand the difference between this is an occupational issue, this is an environmental issue, this is a public broader issue? Is it important to understand exactly what we're talking about, or can you come in and offer your point of view, or will the legislature even know that exact piece of language that you're using?
Well, you asked a very complicated question there, but to be honest with you, you could go in and say, this is a problem. Fluoride's a problem, let's say. And it's up to them to go back to the bill drafter saying, well, where do we regulate fluoride? How does that come in? And it's like, well, no, it's under part of the Safe Drinking Water Act. We deal with it that way. OSHA, half the states have their own state OSHA program, half don't. And if it's going to fall under that, your issue that you have forward, it's good that you know that. And it's also good that they'll figure it out. So obviously it's easier if you go in and say, could you amend section 13-45-804 of the code and say fluoride's a problem, very super simple, or you come in and say, you know, we're having problems with whatever, a part of the within the occupation, we should address that. Or workers have more protection than children do. Shouldn't we address that? Well, something that they will figure out.
Okay. Okay. So we don't, when we're talking with our legislatures, necessarily
You don't have to, but it
know.
makes it better.
Got it.
I want to
Okay.
emphasize that. That will make it better.
There's nothing wrong with it, right? Okay.
Right.
Okay. So fair enough. And then is there some kind of hierarchy in that, you know, and so this kind of goes to, you know, the canon, right? You know, to hold paramount the health, safety, and welfare of the public and to protect, you know, human and environmental health. Is there some kind of hierarchy in this system between public health, environmental health, occupational health? Or are they, you know, kind of all cousins to each other? Is there anything that we should be aware of kind of in that space? Or is it fair game to kind of use the terms interchangeably to some extent when we're talking with legislatures?
Yeah.
I know that puts you on the spot. You can demur if you need.
You know, it would be something you know, with occupational health, you're dealing with a specific group of people.
Okay.
And you have to couch things that way. When you get to public health, you're dealing with another, you know, a broader group of people. When you deal with people who live in HUD homes, that's a different subset. Environmental health encompasses all of it. Occupational health deals with people in occupations,
Okay.
which, you know, is going to lead to inconsistencies, incongruencies out there. Does it make sense to protect a worker more than you do a child? Well, I'm sure you can find a situation where it would be. But that's how, you know, that's how you get the mistakes, the misinformation, the understanding, because people try to do things simplistically when it's not that simplistic. But we have different laws to address different jurisdictions, and it's not universal. If you deal with lead, there are specific things you got to do in an occupational setting. There are specific things you got to do if you got a HUD homes. But when you start talking about the rest of the country, things you do need to do, things you don't need to do, but they're not as detailed as you get when you have those different communities.
Okay. No, fair enough. Fair enough. I think you know, we've got some folks in this audience that are, you know, like building the $1 billion treatment facility. And then we're talking about, you know, an individual tattoo parlor in the same, right? I mean, those are, I think it's probably huge to imagine those coming under the same umbrella of environmental health or public health. And I think really what I hear you saying is they do, in the sense that it's often the place where a lot of these things will land. I guess one question that I think a lot of us would have in our mind in that space, though, is now we think about all these devices that are around us, right? Like what radiation are we getting exposed to, or what kind of occupational or body stress are we getting, right? Like, you know, I'm staring at my screen, leaning over, and you think about strain on the neck and all that kind of, you know, if you kind of look into the tea leaves, do we see some more of these as we get more into a digital information economy, knowledge economy, AI taking? Do we start to see places that public environmental health will be in these in the future, as we've gone from kind of water to, you know, to clean spinach to tattoos to iPhones?
The industry people are ever nimble about what they do. I mean, body art, like I said, I get every time I visit someone, I get shocked about what they're doing. But food too, mobile food. We've got push carts that are selling things, and then you got people who are selling exotic foods. You know, it's not something you do, and get less and less of a kill step in there. Mind you, you know, sushi used to be exotic. How you get it at Kmart, not Kmart, but you know what I mean.
Right, I know what you mean.
You know, it comes everywhere, and so it's something that there's always going to be something new coming down. A few years ago, we did have a lot of discussion about electromagnetic fields. This was causing cancers in cows in Michigan, and we have problem with that. The mad cow disease, and I remember it was just, to me, it was fascinating, and you can correct me. By the Department of Health is that there's no cases of chronic wasting disease that have ever been transmitted to humans.
Right.
Even though they had some people that made some elk burgers from some elk that they killed, they did come down with chronic wasting disease. But he said, but there was no link between the two. To me, I'm not a doctor. To me, that seems like a link. But these are things that we are dealing with constantly. And every year we've got something new that I'm like, I did not see that coming. I didn't see fluoride coming.
Right.
And the food additives, I did not see that coming. We see about half the states have legislation introduced banning certain food additives in certain situations, and it's coming primarily from conservative states. These are the same states that threw a fit when Michelle Obama said should eat apples, school children should eat apples. Now they're saying, oh my gosh, kids really shouldn't be eating or drinking sugary sodas. They shouldn't be they shouldn't be having these additives put into their foods. I'm just, I get every legislative cycle, I get amazed about what they go on. So I'm not going to make any predictions, especially about the future.
Fair enough. Fair enough. So now one of the things here then is knowing the system, right? So you talked about, kill committees at the state level. You talked about, the pocket veto, which just maybe you explain that for folks, because I have my understanding of it, but maybe just to clarify for folks so that they understand kind of what that is, when the session's getting ready to expire and the executive doesn't act on something, so it defaults into not being signed and therefore it dies. Very difficult veto to override. In fact, I think it's essentially impossible to override that as an override. So there's part of this stuff of knowing the system, right? You gave us some insights into how to talk to folks, right? But do I talk to them locally? Do I travel to DC? Do I try to meet them at the local church when they're having their community meeting, or do I try to go to a town hall, all of the above? Do I tell them the things that are going well, or just when I want to complain about something going wrong? How do I know the system and engage the system?
Well, the answer to everything you said is yes. You need to do all that. Now, if you are a public health director, Bill Schmidt, speaking of Missouri, Bill Schmidt was probably the best environmental health director the state ever had. But he told me while we were walking the halls of the legislature there in Jeff City, he said, any decent environmental health director that's not fired in 3 years is not really doing their job. And what he meant to say was, we've got to get out there. We've got to be controversial. We've got to start dealing with things. And to his credit, he was fired within 3 years. But he got some really good things passed in Missouri because he got up there and he started talking about it. For a lot of folks, you don't want to fall on your sword over these things, but you should figure out a way to communicate. How do we talk? Like I said, the number one thing I heard from state legislators, I called the Department of Health. They didn't call me back until I introduced a bill. Al Junke's a Democrat, former Democratic state senator in Minnesota. They have their hot dish fundraiser. The local environmental health agency shut them down. They said Democrats can't have a hot dish event because you're serving too many people and we don't have any oversight. So he's like, he's like, what are you talking about? And he calls the Department of Health, doesn't get any call back. He calls his local, didn't get a call back. So he introduced a bill. Then he started getting called back. And you don't want to get in that kind of situation. You don't want to antagonize your policymakers. You want to work with them. You want to talk to them, explain what's going on. This whole thing could have been avoided, but we weren't. The local Minnesota Environmental Health Agency was reluctant to communicate and deal with their policymakers. Therefore, we ended up with the situation which was very detrimental.
Fair enough. Fair enough. Now, Doug, one of the things we like to do is that we also like to get some advice for folks that'd be listening, because we also get students that watch. We record these, right? So two pieces kind of advice here. One, just to make sure that folks on here understand, since most of this audience is coming from the American Academy for Environmental Engineers and Scientists, that they understand a little bit about the National Environmental Health Association, right? Which has, state affiliates, national organizations. So maybe if we get a little thumbnail of that. And then a little bit also of kind of your advice for folks that want to get into this space. Now, short of, okay, go back and get your law degree, there might be other things people can do. So number one, if you can give us a little thumbnail so that this audience can kind of be like, okay, that's NEHA, that's an organization, membership organization that I could consider engaging with. And a little bit about, the background of how folks could to get into this space working more. So.
Well, you're always welcome to join and work with me and whatnot. I try to remind people that there's one president, there's 100 senators, there's 435 congressmen, there are 50 governors, there are 7,383 state legislators, and there's over 3,500 local health departments out there, all which have a local health board of local health that have to get involved. Each one of those are going to be important to get the message across. I really am a big fan of working with the state and locals. These are people, they just want to do good. They're not going to get rich doing this. That takes time away from their business and their family, but they're doing it because they want to do good. There's no reason why you can't talk to them. You can't sit down with them. Other thing is, at one point I was counting about a half dozen to a dozen environmental health professionals in the legislature. Everything from Senator Brodsky in New York to Paula Kahn in Minnesota, Brandy Fisher out of Fort Collins, Colorado, Spencer Coggs out of Milwaukee. It's surprising, but when you have 7,383, there's no reason why any one of you cannot be a state legislator, cannot be a policymaker, cannot run for your board of health. I don't think you get appointed to the board of health, but get appointed to your board of health. It's something that's very doable. And it's a sign of you being engaged and getting involved and understanding what's going on. But, the simplest thing to do is if you call up your local legislator, not congressman, not governor, but your local legislator or your county commissioner. Can we sit down and have a cup of coffee? Can we just go over this stuff? Can I enlighten you on this? You can talk about the broad notion. Environmental health is kind of unique in a lot of respects. It is primarily state and local funded. It has the support of the local community, because if it didn't, they wouldn't pay their fees, and they make themselves known quite vociferously. If they don't get their way. But this is a group that, we really work hand in hand with to try to make sure the public is safe.
Perfect. And in terms of background for students, need to study law to get into this, can study from the technical side and get into it. Is there something that they should do that helps bridge, or just start meeting people?
That's the wonderful thing about politics is anybody can. I often talk about Lauren Boebert. She represents every mother who ever gave birth in the front seat of her truck, her husband's truck. She represents a group of people. Everybody out there represents a certain continuity. We don't have a lot of people involved with environmental health, but we do have some. Let's get out there. Let's get involved.
Perfect. Fantastic. Well, Doug, thank you for taking time out. We really appreciate this, and we will turn it over to Marissa to wrap up for us.
Okay, thank you everyone for all your questions, and thank you to Doug for sharing your knowledge with us today. We have several webinars planned in the near future, so you can go to aaees.org/events and reserve your spot. Just a reminder, if you're not yet an AAES member and you're considering joining the Academy, please email me and discuss our membership options. For all board certified individuals, PDH certificates for this event will be sent out by the end of the week. That's all for now. We enjoyed being with you all today. Thank you so much and have a great day.
Thanks, Doug.
Thank you.
Bye-bye.